Hello everyone, welcome to Medicus Aeternus, where the journey to mastering medicine never ends. We are here to make learning easier, more enjoyable, and to help you excel in your medical path. So let's dive in and learn something new today. Today we are going to explain about the General Adaptation Syndrome, which is a very important syndrome in the general pathology and will give us the main ideas that will help us understand the next topics. And also, if you saw our videos previously and didn't subscribe, so subscribe and give us a like and share to your friends and anyone who will need this information. Here, if we need to understand the General Adaptation Syndrome, we have to understand the main terms. The first term is stress and the second term is the adaptation. It's also called General Adaptation Syndrome or General Stress Syndrome. Stress is a physiological and a psychological response to any external or internal challenge or stimuli that disrupt an individual's homeostasis or the balance. It involves both the body and the mind to reacting to perceive the threats or the demands. So, the stress in here, we understand that any challenge, anything that will cause the body normal state to be disrupted, and in this case, the body will try to return to its normal state before. Adaptation to stress refers the process which an individual adjusts to the stressor, strive to restore the balance and to cope effectively with it over the time. It involved physical, psychological changes that help the individual manage or minimize the impact of stress. So the adaptation is the way that the body will react to the stress and try to regain its normal balance. Stress has three major components: homeostasis, stress response, and adaptation to stress. Homeostasis is the normal balance of the internal environment inside the body, and stress adaptation arises from the body's complex interactions at the cellular and the systemic levels. To maintain the stability of the body relies on the homeostasis, as we described above, when ensure the balance despite the internal and the external challenge. So here we understand that the homeostasis depends on the constancy of the internal environment, that we have the constant components of the cell and the extracellular matrix through the negative feedback mechanism. That means if something increases, the body will try to regain the normal status. If something decreases, the body will try to regain its status by increasing what has been decreased and decreasing what has been increased. The problem here is the negative feedback. The negative feedback is a pathological process, and we described more about it in the previous video. The control system, which is the second important component, which is the interconnected components that function to keep a physical and the chemical parameters of the body relatively constant. This regulation is achieved by the feedback control systems, especially the negative feedback, and the integrate with the different organs, so it is systemic. And here we can see that stress and adaptation will activate the body's complex interactions, cells, and the organ systems. This will activate the homeostasis, which will maintain the internal balance, internal environment, and this will cause the feedback control system, which regulate the cellular functions and integrate organs, systems, activities. Here we will explain about the first component of homeostasis, constancy of the internal environment. The internal environment, termed milieu intérieur in French by Claude Bernard, refers to the fluid surrounding body cells, which facilitates the exchange of the nutrients and the waste between the cells and organ systems, and this stable internal environment is essential for cellular survival. You know that the cell is living in the liquid medium, fluid medium. In this medium, you will find many different ions, electrolytes, waste products. These products, they should be in their minimum limits, and in these limits that should not exceed or decrease. If anything happened to this, there will be a pathological problem. And homeostasis is the way that how the body tries to regulate these environments. Cannon's homeostasis principle, we know here Walter B. Cannon, an American physiologist, he expanded the idea of Bernard's work. He said that the constant needs regulations, body balance for glucose, temperature, pH, the acidity of the cells, resistance to the change, body counter shift automatically, cooperative regulations, multiple mechanisms that work together because homeostasis is systemic, and self-governed process. Homeostasis is actively maintained. And as we said, that homeostasis is activated by the negative feedback and the positive feedback is pathological. We explained more about that in the previous video, the introduction to pathology. You can find the link in the description below. The next main component of homeostasis is the control systems. The control systems, as we said previously, is the interconnected components that function together to keep a physical and the chemical parameters of the body relatively constant. And we know that the body maintains homeostasis through thousands of control systems that regulate the cellular function, life processes, and organ system integration. These systems, when they regulate and they maintain the stability, they regulate the neuroendocrine system. Neuroendocrine system is one of the main important control systems in the body that alternate and facilitate the ability to withstand the problems and the stressors that affects the behavior and the stress response. And we said about many times about the feedback mechanisms because they are important. The negative feedback, which is a positive one and that restores the balance. It is a good feedback, that's why I put here tick. The example for it is the blood sugar regulation. For example, if we have increased glucose level in the body, this will cause the glucose sensors in the beta cells, which will increase the insulin release and removal of glucose from the body to the tissues, muscle tissues, body tissues, that will decrease the level of glucose in the blood. And if glucose was decreased, then the effect of the alpha cells will release glucagon that will cause the increased rate of glucose, and that's it. So if anything was increased, the body will try to decrease it in the limits that it is indicated previously in the body, in the balanced limits. If it was decreased, the body will try to increase it. The positive feedback, it amplifies the response. For example, unstable temperature control or anything that will cause like bleeding, hemorrhage, that when someone is bleeding, then the heart will try to pump very faster, so that he will have tachycardia. In this case, because the heart needs at that time to regulate the blood circulation in the whole body, it will increase the release of blood to all tissues, and this will also increase the rate of hemorrhage and so on. So there will be no negative regulation that will stop the hemorrhage in that case. If someone has decrease in the coagulation factors and platelet count. The second main factor that the body will try to counter effect the stress effect by the stress response. Stress response is the physical, emotional, and the behavioral reactions to stressors, which are mediated by neuroendocrine control systems, biochemical messengers in our brain control nerve activity, information flow, and ultimately the behavior. Now we will know about Hans Selye, who is a renowned Hungarian-Canadian endocrinologist. In 1930s, he studied stress influence on animal body by exposing stressful events, for example, starvation, extreme temperatures, and excessive exercise. He concluded that whatever stressor, whatever event or environment or agent that causes stressor, the response will be the same. For example, loss in appetite or muscular atrophy, weight loss, and he called this syndrome of just being sick, observing the common symptoms in different diseases. And he concluded that three main triad of responses that he used in his studies, and they are common in all the cases that he studied. The previous one is the adrenal enlargement. Second one is the lymphatic organs atrophy, for example, the thymus, spleen, and lymph nodes. And the third effect is bleeding ulcers that develops in the stomach and the duodenum. I will explain more about why these three effects happened when we discuss the pathogenesis of the stress response. And then he discovered that the hypothalamic pituitary adrenal axis plays a very important role, a key regulator role in the stress response. The hypothalamus by the paraventricular nucleus, the pituitary by the anterior lobe, and the adrenal by the cortex and the medulla of the adrenal glands. And he defined this general response as General Adaptation Syndrome. General because it is general and systemic reaction that affects every system in the body. Adaptation because in reaction to the stress, because it counteracts the effect of the stress. And syndrome because of the physical manifestations were coordinated and dependent upon each other. General Adaptation Syndrome, it has 3 stages. The alarm stage. In this alarm stage, there will be generalized stimulation of the sympathetic nervous system and the hypothalamic pituitary adrenal axis, which will release the catecholamines and the cortisol. It happens by that the hypothalamus produces the corticotropin releasing hormone, which will activate the sympathetic nervous system. The sympathetic nervous system will stimulate the adrenal medulla to release the catecholamines, norepinephrine and epinephrine, and also the corticotropic releasing hormone will affect and stimulate the production of the adrenocorticotropic hormone by the pituitary gland. This hormone will activate the adrenal cortex to produce corticosteroids, for example the cortisol. The main events in this stage, there will be increase in oxygen delivery to tissues, increase in the level of these hormones, the adrenocorticotropic hormone, the corticotropin releasing hormone, cortisol, and the catecholamines. There will be also increase in heart rate, increase in the respiratory rate, increase in glucose levels due to the effect of the cortisol, and increase in the blood pressure due to the increase of the heart rate. And there will be decrease in size of the lymphatic nodes, spleen, and also there will be stress ulcers. The decrease in the size of the lymphatic nodes, it will happen because the counter effect of the stress to the immune system. The stress ulcers because, in case of the stress, there will be vasoconstriction, and this vasoconstriction will cause the mucosa of the stomach and the duodenum to be thin. And in this case, because of the stomach will release the HCl, will cause destruction of the mucosa. This will cause the stress ulcers. The next stage is the resistance stage. In this stage, there will be increase in the concentration of nutrients, increase of glucose, free fatty acids, amino acids due to the effect of the cortisol levels. And in this stage, cortisol level will drop. But the thing here that if the person stays for a long time in this stage, there will be new baseline steady state for different physiological variables, because that as we said, there are some limits, some baseline limits. That means the concentration of oxygen is between these limits of carbon dioxide and this limits, acid base balance should be in this limit. But in this stage, the body will try to regulate itself by forming new baseline limits to adapt to this new state, because if someone is come to this state, that means the stress is not acute anymore, it's now chronic. For example, we know that the partial pressure of carbon dioxide is between 35 to 45 millimeters of mercury in normal people. But in case of someone with COPD, it will be from 50 to 60 millimeters of mercury. That means it's increased due to the hypoxic state that he is. Hypoxia means decrease in oxygen level. Exhaustion stage, the third stage, and if someone reach in this stage, there will be depletion of resources, wear and tear period of systemic, decrease in the resistance, and there will be no more of the nutrients. There will be also decrease in the CNS activity, the central nervous system, and this will release to the negative consequences, in this case death. Two main types of stress: the EU stress, the positive one, and the DIS stress, the negative one. The eustress is mild stress that promotes vigilance, growth, adaptation, and all of us need that kind of stress to keep up in living. The chronic stress, which will lead to health issues, the distress, because it's either increase in the effect or decrease in the effect, which will facilitate the destruction of the body by itself or by infections. Now we will discuss about the neuroendocrine responses to stress. As we said before, that the neuroendocrine system is one of the main control systems in case of homeostasis. The central nervous system, it has these components: the cerebral cortex, which is important for the cognition, focus, awareness; the limbic system, which is important for memory, emotions, fear, anger, excitement; the thalamus, which is the main sensory relay center, so whatever sensories you have, pain, temperature, they will go to the thalamus to be regulated; the hypothalamus, which is the master regulatory of endocrine and the autonomic nervous system responses; the reticular activating system, which is important for the mental alertness and muscle tone; and the locus coeruleus, which is in the brainstem. It produces norepinephrine and activates the sympathetic nervous system. In this case, we understand that the locus coeruleus produces norepinephrine the same way as the adrenal glands. So we have two places that the body can produce norepinephrine: adrenal glands and the locus coeruleus in the brainstem. The endocrine system, we have here the hypothalamus releasing factor, the corticotropin releasing factor or hormone that stimulates the adrenocorticotropic hormone released from the pituitary gland. The adrenocorticotropic hormone stimulates the adrenal glands to secrete cortisol and catecholamines, and cortisol regulates the metabolism, immunity, cardiovascular system, stress response, and also here we have the catecholamines, the norepinephrine and the epinephrine, which will do mainly the same action. Here we'll discuss more about the hormones that are involved in neuroendocrine responses to stress. This table is an important table because it shows the hormones associated along with the sources and the effects of these hormones. So here we have catecholamines, the norepinephrine and the epinephrine, and the sources, as we said, the locus coeruleus in the brainstem and the adrenal medulla in the adrenal gland. The physiological effects, we said that produce a decrease in insulin release and an increase in glucagon release. This results in increase in glycogenolysis, gluconeogenesis, lipolysis, proteolysis, and decreased glucose uptake by the peripheral tissue. Glycogenolysis, that means destruction of glycogens. Gluconeogenesis, formation of new glucose by either lipolysis, destruction of lipids, proteolysis, destruction of proteins, and it decreases the glucose uptake by the peripheral tissues. So the main thing is the important organs, the heart, the brain, kidneys, liver, lungs, and it also will be an increase in heart rate and the cardiac contractility and vascular smooth muscle contraction. Also, this will cause relaxation of the bronchial smooth muscles. So if you are in a stressful situation, you need to breathe more oxygen and your heart to pump more, so it will help and supply your peripheral organs. The next hormone is the corticotropin releasing factor or hormone that is released by the hypothalamus. It stimulates the adrenocorticotropic hormone released from the anterior pituitary gland and increase the activity of the neurons in the locus coeruleus. The adrenocorticotropic hormone, it stimulates the synthesis and release of cortisol, and it's released from the anterior pituitary gland. The glucocorticoid hormones, cortisol, released by the adrenal cortex, potentiates the action of the epinephrine and the glucagon, inhibits the release or action of reproductive hormones and thyroid stimulating hormone, and produces a decrease in immune cells and inflammatory mediators. It also decreases the effect of the growth hormone. The mineralocorticoid hormones, for example the aldosterone, and also the antidiuretic hormone, the ADH, vasopressin. Mineralocorticosteroid hormone released released by the adrenal cortex, and it increases the sodium absorption by the kidney. And we know whenever the sodium is absorbed, water will follow the sodium. The antidiuretic hormone released by the hypothalamus and the posterior pituitary, it formed in the hypothalamus and it's stored in the posterior pituitary, and then in the posterior pituitary it will release in case if it's needed. It increases water absorption by the kidney, produces vasoconstriction of blood vessels, and stimulates the release of the adrenocorticotropic hormone. These two hormones, it helps in keeping water in the body, so there will be decrease in micturition and urination, and of course you don't need to pee yourself when you are in a stressful situation. This diagram, it shows the effect of this neuroendocrine system between each other. It shows here that the cerebral cortex, which is important for the vigilance, cognition, focus, and attention, it affects all these and they affect it as well. It affects the thalamus, which is the sensory input comes to it, and it also affects the limbic system, the emotional response system, could affect the hypothalamus. The hypothalamus will affect the anterior pituitary gland by the corticotropin releasing factor, the anterior pituitary by the adrenocorticotropin releasing corticotropic hormone, which will affect the adrenal cortex. The cortex will release the cortisol, which will cause alteration in glucose and fat and suppression of the inflammatory and the immune responses. And the hypothalamus will affect the locus coeruleus, and as you see here, the connection and the interrelationship between all of these factors here. So we know that the neuroendocrine pathways and physiological responses to stress, and you need to keep the main hormones that will affect these factors and will keep the relationship between them, the adrenocorticotropic hormone and the corticotropic releasing factor, and also the catecholamines, epinephrine and norepinephrine, as well as the cortisol. Now we will discuss two main terms in the stress response, the allostasis and the allostatic load. The allostasis is the body's attempt to maintain the stability through change, thereby adequately or inadequately adapting to the threatening or the unpredictable stimuli. And the allostasis load is the persistent accumulation of these allostatic changes. For example, the immunosuppression, the activation of the sympathetic nervous system, activation of the hypothalamic pituitary adrenal axis, and the activation of the RAS system, the renin-angiotensin-aldosterone system. These can be measured by increased blood pressure, increased cortisol, increased BMI, the body mass index due to cortisol effect, and increase in the cortisol cholesterol level. The effects of the stress response, they can be long-term chronic stress, which is a maladaptive, and the short-term acute stress, which is adaptive. Stress, if it is acute, it's important and it is helpful for the body because it increases alertness, focus, energy, immune function. It improves the cardiovascular and the respiratory function. While the chronic stress, which is for a long time, it causes immunosuppression due to the effect of the cortisol as it inactivates the immune system. There will be more infections. The body will be predisposed to infections, cardiovascular issues, high blood pressure, which will cause heart diseases, metabolic tissues, high blood glucose, obesity, and reproductive issues, infertility, and hormone imbalance because cortisol affects the reproductive hormones. New table that will show the hormones, the sources, and the function in a very easy way. The fight or flight response, the sympathetic activation. This will show the acute stress. The sympathetic nervous system will be activated. This will cause rapid response to stress, acute response. It will cause increased heart rate, blood pressure, alertness, so that the body will take blood supply and will try to fight or flight from this response. There will be dilated pupil, so the vision will be enhanced. There will be reduced digestion. This will keep energy, and also because of the activation of the sympathetic nervous system, as the GI tract is activated by the parasympathetic nervous system. Moist skin, tense muscles. This will cause the preparation for action, and also due to the increase of the level of the glucose. The stress response is essential for survival, but the chronic one leads to diseases. And the balancing the response, reducing the allostatic load, is the key of maintaining health, because the allostatic load will cause change in the balanced limits in the body, as we discussed previously. Here you can see the hormones that are released from their main organs, like the corticotropin releasing factor from the paraventricular nucleus in the hypothalamus, the locus coeruleus in the brainstem, which will release the catecholamines, along with the adrenal medulla, the cortisol from the adrenal cortex, the pituitary gland will release adrenocorticotropic hormone, and the neuroendocrine immune system regulations of the stress response. Further explanation for the neuroendocrine and immune responses to stress. We have here the first one is the stress response system, which is mediated by the central nervous system and the peripheral tissues. The key players here are the neuroendocrine system and the immune system. The neuroendocrine system will integrate the neural and the hormonal signals, as we discussed before, and the immune system, which will both be influenced by the stress and also by the hormones that will cause its decrease. The hormonal response and effects. The hypothalamic pituitary adrenal axis, which will release the corticotropin releasing factor from the hypothalamus, which will activate the adrenal corticotropic hormone in the pituitary, which will cause the cortisol release in the adrenal cortex. The effects will increase blood glucose, suppress the immunity, inhibit the growth and reproduction. The CNS activation, flight or flight, release of the norepinephrine from the locus coeruleus, and also increase in the heart rate, the redirect blood and decrease in the digestion. The RAS system, the angiotensin II, it will cause the same thing, increase in the blood pressure, increase in the fluid retention, and stimulate the ACTH and the norepinephrine. The immune system and the stress, cortisol and the sympathetic nervous system will suppress the immune function and will alter the cytokine release, decrease the release of the cytokines, the interleukin 1, interleukin 6, and tumor necrotic factor alpha. Immune cells that cross the blood-brain barrier, cytokines will influence the stress response. Chronic stress effects. Here we'll have in prolonged stress, they will cause health issues, decrease in the immunity, increase in the infection, increase in the blood pressure and heart strain, cardiovascular diseases. It will cause metabolic disorders, diabetes and obesity due to the hyperglycemia, increase in the blood glucose levels, and mental health effects, anxiety and depression. Now we will discuss about the adaptation, the third main concept in homeostasis. Adaptation, as the René Dubois said, that adaptability is what separates the living organisms from the inanimate matter. And you can find it's true, because if an organism is able to adjust itself and its internal and external environment, that shows it is a living organism. There are some types of adaptation: biological adaptation, behavioral adaptation, and social adaptation. Biological is by what we understood from homeostasis, the internal physiological adjustments. The behavioral adaptation is the change in the actions and the habitats. And the social is when people modify the environment around them and their lifestyle. Example for that is the air conditioning, the antiseptics that people use to destroy microorganisms and decrease the level of infection. Here we will see some evolutionary perspective, like the primitive organisms, they have the basic survival responses, while the higher organisms, they have advanced adaptive mechanisms due to developed neuroendocrine system. The humans, they are the most complex and the most developed organisms, because they also have the social adaptation, that the population itself will try to adapt to the environment that they are living in. Adaptation is essential for survival and varies across species. The more developed the species, the more adaptable they are. Higher organisms have more advanced adaptive responses, and the humans adapt biologically, behaviorally, and socially. As we said previously, that humans are advanced creatures and they have environmental control, physiological control, and psychological control. The environmental control, for example, the air conditioning, heating, antiseptics, immunization, antibiotics, but the thing that they create new stressors, for example, noise, air pollution, harmful chemicals, disrupted biological rhythms, change in the circadian rhythm. The physiological responses, here the feedback mechanisms, moment-to-moment control, the baroreflex increase in the heart rate when standing, specific and some transient responses, tailored to the type of the disturbance. Psychological responses, here we have have less specific with less precise feedback control and may result in sustained or inappropriate reactions. Now we will discuss some factors that affect the coping mechanism to the stressful situation. First one is the physiological and the anatomical reserve. It shows here that the ability of the body systems to increase the level of function given to the need to adapt to any stressful situation. For example, here if we have a decrease in oxygen level in the atmospheric air, this will cause an increase in the RBC count in the body, erythropoiesis, increase in production of RBCs. Time here, adaptation is more efficient when the change occur gradually rather than suddenly. Genetics, the genetic endowment in different variants for certain genes, it determines how an individual responds to the stressful experience. For example, the inherited variant of the serotonin transporter gene is associated with a number of conditions, for example, alcoholism. Age and gender. The age shows that if someone is old or someone is too young infant, they have some problems in the immune system and how they adapt with the stressful situations. And the gender here, there are some fundamental differences in the position and the regulation of the individual genes in the male and in the female genome that account at a very basic for level of different physiological function. For example, here in the male hypothalamus, they will produce more corticotropic releasing factor and adrenocorticotropic hormone than the premenopausal female, while in the female hypothalamus there will be increased production of vasopressin. Health and nutrition, it shows that if someone is the nutrition is good, that means the adaptation mechanisms will be better than if someone has malnutrition. Sleep and biological rhythms, it shows that the circadian rhythm, and in Latin circa means about and dies means the day, that means the rhythm about the day, and any alterations lead to a change in the immune function and some psychological functioning also. Personality and the resilience, the hardiness, it shows some kind of personality which is characterized with a sense of control over the environment and demonstrate more moderate and healthy immune and neuroendocrine responses to the stress. The psychological factors here, we have the social environment and how it affects the body's ability to adapt. Why adaptation is important here? It prevents the stress-related illnesses, it enhances the overall well-being of the body, and it improves long-term survival in the changing environments. Here we'll discuss about the types of the stressors. The acute time limited, which occurs over a short amount of time and doesn't reoccur again. The chronic intermittent stressor, which is the frequent exposure to stressor to which the body is asked to respond, and this determines the availability and the efficiency of the stress response. This response is more rapid and efficient on the in further exposures to the same stressor. The third one is the chronic sustained, which cause fatigue and impair the effectiveness of the body's ability to adapt to the stressor. The effects of the immune system, the first exposure, repeated exposure, and the chronic exposure. The first and the repeated, we discussed them in the chronic intermittent and how that the repeated the body will adapt to it much faster than the first one. But the chronic exposure is like the chronic sustained, which will cause damage to body's systems. Effects of the acute stress. The acute stress will facilitate the activation of the neural pathway, which will mediate the arousal, alertness, vigilance, cognition, and focus. It will be detrimental for people with limited coping abilities, either because of physical or any mental illness. Due to increase in the cortisol level, there will be stress-induced hyperglycemia, which has worse outcomes on the bodily systems, comparing with the acute coronary syndromes, for example, the septic shock and the hemorrhagic shock and the strokes. This shows about the general response of the autonomic nervous system, the potential detrimental effects that will cause for the cardiovascular system, and the stress-induced hyperglycemia, as we said, which is much more dangerous than main syndromes, the septic shock, the hemorrhagic shock, and the stroke, and whatever. And the physiological impacts in the critical illness, the HPA axis, which will activate the cortisol release and how it will affect the inflammation and the metabolic way. The effect of the chronic stress, it will cause dysfunctioning in the neural and the hormonal connection, which will be prolonged and overwhelming magnitude of the stimuli. This will result in chronic illnesses, disruption of inflammatory phase of wound repair, to decrease in the synthesis of the collagen because of the effect of cortisol. Chronic stress has been also linked to specific pathways that impact cancer and growth of the metastasis. And chronic stress contributes to major diseases, cardiovascular issues, hypertension and heart diseases, gastrointestinal disorders, ulcers, as I explained before, immune suppression, increased infections and delay healing, neurological effects, depression, anxiety and addiction. Addiction because if someone in chronic stress, he will try to relieve himself by using substances and drugs. Increased risk of accidents and suicide. Workplace stress is recognized as public health hazard here. Post-traumatic stress disorder is an example of chronic activation of stress response to any traumatic event. It is initially known as the battle fatigue or shell shock in war veterans, and it's caused by any combat, any natural disaster, any assault, abuse, accidents, or any other life-threatening event. It was explained by the DSM-5, the American Psychiatric Association's Diagnostic and Statistical Manual for Mental Disorders, as an exposure to actual or threatened death situation, serious injury or sexual experience by either direct experience, witnessing, learning that it happened to a close family member or friend, or being repeatedly exposed to that action. The symptoms here, we have the intrusion phase. In the intrusion phase, we have the recurrent involuntary distress memories, the avoidance. The person will try to avoid the situations, avoid places, people, any activities that will arouse the distress memories. Negative cognition and mood disturbances, inability to remember important aspects of the event. This is also called dissociative amnesia. Marked alteration in arousal and reactivity, inability to experience positive emotions, self-blaming also that will happen, that will cause sleep disturbance. Pathophysiology of PTSD here, we will have increase in the reactivity of the amygdala and the hypothalamus, decrease the activity of the anterior cingulate and the orbitofrontal areas, and these areas are involved in fear responses. It also here by the HPA axis and the SNS dysfunction, overactive stress response but low cortisol levels. The diagnosis and the treatment is linked to chronic health issues like heart disease and depression. First line treatment are the SSRIs, the selective serotonin reuptake inhibitors, and you will learn more about them in the pharmacology course. The psychotherapy, cognitive behavioral therapy. The other treatment is group therapy, crisis intervention, exercise, and stress management, because mostly this disorder is psychiatric disorder. Thank you for watching Medicus Aeternus. Remember, the journey of medical professional is eternal, and we are here to guide you every step of the way. Don't forget to subscribe, hit that bell for updates, and show some love by liking and sharing this video with your friends. Stay awesome, keep learning and thriving.